Hello everyone, my name is Ambrosio, and today I'd like to speak on healthcare access, COVID vaccination rates, and willingness. For background, the African American community has been severely disproportionately affected by the COVID-19 pandemic, and recent studies have even shown that they are 5 times more likely to be hospitalized than white individuals. And older African American adults may have serious chronic conditions and difficulties in accessing quality healthcare that may exacerbate severe COVID-19 hospitalizations. Even though we have vaccine rollouts across the country, there has been vaccine hesitancy in African American adults. And so we hope in our research to be able to understand the opinions of African American older adults, 65 and older, living in South LA about their access to quality care, their willingness to be vaccinated, and their actual vaccination rates. And so to do this, we partnered with churches and church leaders in South LA, and we hoped to partner with them to spread the knowledge of COVID-19. So in our research, we administered a self-administered test to each participant about their access to quality care, their willingness to be vaccinated, and their vaccination status. And on the next slide, we will discuss the results that we found from these surveys. So in figure A, the first question we asked individuals was to rate their quality of care on a scale from 0 to 10. And from 112 participants, we found that 56% of them rated their care a 1 out of 10, meaning that it was poor health care. Surprisingly, you can also see the other 46% rated their care 2 to 3, 4 to 5, and 6 to 7, with 7% not answering the question. As you can see, surprisingly, none of the participants rated their care above a 7 out of 10. In the next question, we asked participants how willing they would be to receive the COVID vaccine when it is readily available to them. And this result surprised us in that we found that 66% of people didn't answer the question and deferred their answer, while 28% did say yes, definitely, 4% were most likely, and 2% had not decided yet. Similarly, in question C, we asked participants about their vaccine reception. We asked them their vaccination status, and surprisingly, again, we saw that 66% of individuals, or 74 individuals out of 112, deferred their answer and did not answer this question. We saw that 31% were fully vaccinated either with both dosages or with the Johnson & Johnson, 2% was not vaccinated, and 1% was partially vaccinated. And so from this data, we found that individuals of African American communities and older adults in South LA had difficulty finding quality care. And that was similar to the national research that we saw about African American communities facing difficult barriers to care, including quality health care. As you can see from the data, individuals mostly rated a 1 out of 10, which is very poor health care, and nobody rated their health care above a 7. In questions B and C, we also saw that individuals did not even want to answer questions about vaccine willingness or what their vaccination status was. And this data mimics the vaccine hesitancy in the African American community that we have seen in national United States research. And so from this data, we see that there is a prevalent lack of quality health care and vaccine hesitancy in this subset of the African American community. Hopefully in future research, we will be able to quantify if there is a correlation between a lack of quality care and how that affects vaccine willingness and vaccine reception. And we hope that with this research and future research, we're able to prevent severe outbreaks of COVID-19, especially in the African American community of South LA, so that we can combat the disproportional barriers to healthcare that they face. Here, we'd just like to acknowledge Charles Drew University and Xavier University of Louisiana. And if you have any questions, please feel free to email me. My email is listed below. Thank you so much.